your experience as a physician, what happens when patients are unable to access primary care in their communities?
When patients can't access primary care, they end up in the hospital. They end up, for example, I think about a patient who I saw in the ICU from an opioid overdose. And how does somebody land in an ICU following an opioid overdose? They may not have had treatment for their addiction. There are also all sorts of health conditions, of problems.
Senator Marky.
Thank you, Mr. Chairman, very much. And I just want to start by pointing out that we're holding this hearing on the 340B program and hospital finances in the middle of a healthcare shutdown in our country. Over the summer, the Republicans passed a bill to gut Medicaid and our entire healthcare system. Hospitals in Massachusetts are expecting to lose between $350 and $600 million over the next decade. I commissioned a report from the University of North Carolina that found that over 300 rural hospitals are at risk of closure or having to cut services because of that bill. The hospitals that survive will have to find a way to balance the books while caring for a surge in uninsured patients. And so now, on top of that, Republicans are blocking a continuation of the premium tax credits that help millions of Americans afford health insurance. The ticking time bomb is about to go off. Over 300,000 people in Massachusetts alone are finding out this month that their premiums are about to skyrocket, and many will decide that they can no longer afford health insurance. So Trump's Make America Sick Again agenda hurts families struggling to pay their bills and makes it less likely that a hospital will be there for them when they need help. So Dr. Feldman, thank you for joining us. Thank you for your work on the investigation that I led with other members of this committee on the extreme prices companies have been charging for inhalers. Our investigation led companies to lower the price of inhalers, a critical win for patients. So Dr. Feldman, you worked in Massachusetts for more than a decade, so it probably won't surprise you that more than 60% of them operate in the red. What impacts on hospitals and their patients can we expect to see if cuts to Medicaid and premium tax credits are not reversed, especially for hospitals already losing money this year?
I think we could see really devastating effects on the health of patients in Massachusetts and in other states in our country. I think we could see less screening. We could see less management of blood pressure, less diabetes care. We could see more hospitalizations for heart disease and for respiratory disease. So I think that you're absolutely right to point out how these cuts will translate into health losses and how hospitals in your state and other states will bear the brunt of patients losing their insurance coverage.
Yeah, thank you. Well, we know that the Republican bill, as it was passed, is going to have a dramatic impact on Medicaid. It's going to force Medicaid work requirements, which we know are just new paperwork requirements nationwide. And last month, the GAO issued a report on Medicaid work requirements in Georgia. Ms. Rosenberg, how much did GAO determine that it costs to administer these onerous requirements?
We found that between fiscal year 2021 and the second quarter of 2025, Georgia spent about $54 million on administrative spending for its work requirements demonstration.
Yeah, so that's $54 million in just one state spent on red tape instead of on making Americans healthier and lowering their bills, and that's just wrong. It's just absolutely an inefficient way of dealing with all of these issues. Dr. Feldman, back to you. If someone loses their health insurance because they were unable to complete time-consuming and complicated forms, how would you expect that to impact their health? Would that make them more or less likely to be able to, find and to keep their job?
I think that it could have bad consequences for their health, and it could make them less likely to be able to work. I think about somebody, for example, who can't afford their inhaler, who isn't taking the maintenance therapy that is prescribed to them, who then finds themselves dealing with a COPD exacerbation and out of work, unable to contribute.
Yeah, thank you. Preventative healthcare is a moral imperative. It keeps families healthy, patients out of the emergency room, and healthcare affordable. Community health centers are key providers of preventative and primary care, and 340B is crucial to health centers trying to keep the lights on. Dr. Feldman, can you share from your experience as a physician what happens when patients are unable to access primary care in their communities?
When patients can't access primary care, they end up in the hospital. They end up, for example, I think about a patient who I saw in the ICU from an opioid overdose. And how does somebody land in an ICU following
Senator
an
Ed
opioid
Marky
overdose?
warned in
They
a
may not have
Senate
had
hearing
treatment
that
for
Republican-led cuts to
their
Medicaid
addiction.
and premium tax credits could devastate
There are also all
hospitals
sorts
and
of
leave millions without
health
affordable
conditions,
care.
of problems that
He said
arise
Massachusetts
years later
hospitals could
because you
lose
didn't get the
between
cancer screening that you needed, or
$350
because
and
you
$600
couldn't treat
million
your
over
high
the
blood
next
pressure,
decade,
which results
while a
in heart
University
disease
of North
down the
Carolina
road. So I
report
think
found more
you
than
have immediate
300 rural
effects
hospitals
of
nationwide at
loss
risk
of health
closure.
insurance coverage. You
Marky
have
argued
far
that these
downstream
cuts would
effects
force
that can
hospitals
be
to
equally
treat
as
more
problematic.
uninsured
And
patients
again,
and
Yale
drive up
University is
costs,
saying that
calling it
50,000
part of
people a
Trump's
year are
Make
gonna
America
die
Sick
because
Again
of this
agenda.
reduction in
He
healthcare
also
coverage.
highlighted that
Thank you.
over
Thank you, Mr. Chairman.
300,000 Massachusetts residents may see their insurance premiums skyrocket. Dr. Feldman, a healthcare expert, testified that losing coverage would mean less preventative care, fewer screenings, and more hospitalizations from conditions like heart disease and diabetes. Marky criticized Medicaid work requirements after a GAO report showed Georgia spent $54 million just to administer them, calling it wasted money that could have gone to patients. He stressed that preventative care and community health centers are vital to keeping families healthy and that cuts could cost lives. Citing Yale research, Marky said up to 50,000 Americans could die each year from reduced healthcare coverage.